Here in Pensacola, we provide a strong clinical training program in a community hospital setting, which has a great volume in both OB and GYN care. And we have this academic affiliation, which also provides a focus on scholarly activity and research support. Most of our clinical time is spent here on the Sacred Heart campus, where our mission is to provide care to the underserved population, as well as that complex medical and complex surgical care. We are a tertiary hospital where we're receiving the referrals in from a pretty good sized geographic area. One thing that sets us apart is really having a rigorous and challenging training environment, but also in a very supportive environment.
Yeah, I knew I wanted a residency program that had good community roots, as well as I knew I wanted a program that had early exposure to the subspecialties. All the residents really enjoy being really close with the faculty, and there's a very good relationship between the faculty and the residents.
Our faculty are very supportive of our residents. They are involved in all of their rotations. So whether you're on the floor on labor and delivery or in the office setting, they'll be attending physician to help guide you through those patient cases.
Our attendings are very hands-on, and they start interacting with us day one. And so they see how our surgical skills progress. They can see your growth even before you can see it or before you can realize it. We have a really great group of residents here. I feel like we all really enjoy being around each other and coming to work, which makes the work kind of more fun.
Many of our residents go on to join the local community, different local practices for general OBGYN. So we help them network with different practices in the area. If they're trying to return home or a little further area, we help them network through ACOG. We support them with doing different conferences on the regional and national level.
The most rewarding thing is just seeing how much me and my classmates have grown and how fast you learn and how fast you get experience with different aspects of the OBGYN care. It's really rewarding to know that the amount of work you put in studying and learning the skills directly impacts patients in a positive way.
If you look around this local community, you'll find that many of the OBGYN physicians are actual graduates of our program, which I think speaks to how much people really love this area, love this town, and really want to continue to give back to the community.
My goal is to be a generalist OBGYN, and I want to practice to the full scope of that. I want to be able to handle problems from infertility to menopause. The way you're able to do that as a generalist is really get your hands in there as a resident and really work with the subspecialties. When I interviewed at this program, I heard a lot about how much OR time you got, how many operations you got to do with the gynecologic oncologist. You get to operate on the robot here really early on. I think all of that has really held true. We have a diverse population of patients, which is really incredible. We have a diverse pathology base here, which means that a lot of times we see some really rare things, but we're trained really well and we know how to manage those complications, which might seem like a lot in residency, but it's just further preparing us for when we graduate.